Hello everyone. Today we will be discussing about the regulation of blood glucose. This is a very important topic because this is something which happens in our body every day without our knowledge. Only when something goes wrong, when our blood sugar level shoots up, we start to think as to what has gone wrong. And in order to make it better understandable, we will also be touching upon the normal blood sugar as well as the renal threshold. I am Dr. Priya Josen Akkara from the Department of Life Sciences, Christu Jayanti College, Bengaluru. Why is normal sugar important? Okay, so the blood sugar levels can either be normal, high or low depending on how much glucose someone has in their bloodstream. Glucose is a simple sugar that is present in the bloodstream at all times. Normal blood glucose levels can be measured when someone fasts, eats or after they have eaten. So this is what you usually do when you go to a lab to test. You might go for a fasting blood sugar, or they might ask you to take your blood sugar when after eating or after 2 hours after eating. So this is to give a better understanding as to how well your body is accommodating the glucose or how well your insulin is working in order to remove the glucose. So a normal blood glucose level for adults without diabetes who haven't eaten for at least 8 hours, that is what you mean by fasting, is less than 100 milligrams per deciliter. And a normal blood glucose level for adults without diabetes 2 hours after eating is also found to be 90 to 110 milligram per deciliter, which means after you eat, after 2 hours, the insulin would have worked on the blood glucose in order to reduce the blood glucose level. So even after 2 hours, if it is going beyond 140 milligram per deciliter, it means there is something wrong. So to remember, normal blood sugar level is at fasting has to be below 100 milligram per deciliter, preferably 90 milligram per deciliter. Now factors which affect blood sugar level throughout the day. So it can change depending upon certain factors. Which are they? The type of food consumed, how much and when. Okay, so if you are eating a lot of carbohydrate rich food, then your blood sugar level can increase. Physical activity. Medications, for example, steroid hormones. If you are taking a drug of steroid hormones, that itself can activate in order for increasing the blood glucose level. Other medical conditions, for example, if you have some certain diseases, that diseases itself can induce certain hormones to increase the blood glucose level. Then of course your age, you must have been familiar with people getting diabetes after 50 years of age. Stress, of course, is an important factor which leads to diabetes, because stress hormone is a hormone which actually activates the mechanism for increasing the blood sugar in the blood sugar. And dehydration, illness, different types of illness, menstrual periods, and of course alcohol, continuous usage of alcohol can lead to an increase in blood sugar level. Now coming to more aspects on normal blood sugar level, an ideal blood sugar level for anyone without diabetes or pre-diabetes regardless of age in the morning should be less than 100 milligram per deciliter. This is something which we emphasize, and this is something which you should always remember. Blood sugar levels can fluctuate throughout the day as a result of the factors which we just now mentioned, and blood glucose levels outside the ranges listed above are categorized as either high or low blood sugar level. So even if it is low blood sugar, it is actually bad. So blood sugar levels are considered high if they are over 130 milligram per deciliter before a meal, which means even if without having a meal, randomly when you check blood sugar, if it is beyond 130 or 180 milligram per deciliter within 1 to 2 hours after a meal. So even after having a meal and after 2 hours, if you are testing your blood sugar, if it is above 180 milligram, there is a reason for concern. So many people won't start to experience the symptoms from high blood sugar until their levels are at 250 milligrams per deciliter or higher. So this is a reason why we say that after the age of 40, it is better to check your blood sugar level every year, because there are no symptoms until it reaches above 250 milligram per deciliter, and beyond that you will be reaching a stage where things becomes difficult to reverse the blood sugar level. So the highest blood sugar level that is considered to be safe will depend on the person and whether they have diabetes, but will typically be between 160 to 240 milligram per deciliter. Now coming to the levels, okay. So if you're found to be normal, your fasting blood sugar level should be between 70 to 100 milligram per deciliters. So these numbers are very, very important, okay. So when your fasting blood sugar level is between 70 to 100 milligram per deciliter, it is called as normal blood sugar. While after you have a meal, post-meal blood sugar levels, that is immediately after you have a meal, said, or after 2 hours after meal, if it is ranging from it should range between 70 to 140 milligram per deciliter, if that, which means if it is above 140 milligram per deciliter or 180 milligram per deciliter, it becomes higher, but till 140 it is fine because you had a meal, and that because of that your glucose level would have gone up. But if your fasting blood sugar level is between 101 to 125 milligram per deciliter, you are considered to be pre-diabetic. That is the first step before you step into diabetes, okay. So this is a place where you can actually control yourself, your diet, your lifestyle, okay, exercises, the food you eat, all these can actually help you to control you becoming a diabetic patient. So once you diagnose that you are in the pre-diabetic stage, that is the stage where you should act. And for pre-diabetic people, post-meal blood sugar levels, that is immediately after you have a blood sugar level, after you have food, your blood sugar level 141 to 200 milligram per deciliter, even after 2 hours after eating, the sugar level is not coming down, you are considered to be pre-diabetic. Now, if you are diabetic, your fasting blood sugar level, that means after 8 hours of fasting without any food, early in the morning when you take your blood glucose, if it is above 125 milligram per deciliter and above, you are considered to be diabetic. So then you go for your postprandial sugar also, that is after your food, after 2 hours, you check your blood sugar level again. If it is above 200 milligram per deciliter and above, it is considered to be diabetic. But please don't immediately you should not consider that you are diabetic. You should go for further tests, the glucose tolerance test and all these tests if you go further to stabilize whether you are actually diabetic or not. Now coming to renal threshold, this is a term which is very important. This is how your kidney actually filters your glucose. Okay. So in physiology, the renal threshold is a concentration of a substance dissolved in the blood which the kidneys begin to remove it into the urine. Okay. So that is a function of the kidney. But the plasma glucose concentration above which significant glucosuria occurs is called the renal threshold for glucose, which means after a particular level of glucose in your blood, what happens is the kidney is not able to filter the glucose, and what happens, glucose is eliminated through urea and the presence urine, of course, and if glucose in urine is what is called as glucoseuria. Glucose in blood is called as glucosemia. Okay. So its value is variable and deviations occur both above and below the commonly accepted normal threshold. So remember, the renal threshold of glucose is 180 milligram per deciliter. So if it is beyond that, glucose starts getting eliminated through urine, which is called as glucoseuria, which is almost the first symptom of diabetes. So in diabetic patients, the value is reported to vary from 54 to 300 milligram per deciliter, depending upon the medications which they take also. Now, renal tubule plays a significant role in glucose reabsorption. So if the plasma glucose rises, what happens? The renal tubular reabsorption of glucose will increase linearly until it reaches its maximum tubular resorptive capacity. So there is a capacity for your renal tubules also to reabsorb the glucose. So the capacity of the proximal tubule to reabsorb glucose to prevent it passing to the urine is known as renal threshold. So there are two definitions of renal threshold which we discuss now, and you should remember the renal threshold value of glucose is 180 milligram per deciliter. Now coming to regulation of blood glucose, why is this important? Okay. So in our body, morning, afternoon, evening, night, we have food, and the body has different mechanisms by which the blood glucose level is kept constant. What are those? So regulation of glucose in the body is done autonomically and constantly throughout each minute of the day. Now when I am speaking also, our system is working, my system is working, my hormones are working in order to balance the blood glucose. So the normal blood glucose level should be between 60 and 140 milligram per deciliter in order to supply cells of the body with the required energy. So you need glucose to work, okay? Your brain needs glucose to work, your cells needs glucose to work. So too little glucose is also very dangerous. It is called as hypoglycemia. Higher glucose, higher amount of glucose is called as hyperglycemia, and too little glucose is what is called as hypoglycemia. So euglycemia, what is euglycemia? It is nothing but blood sugar within the normal range. So we have learned three terms. Normal blood glucose is called as euglycemia, lesser amount of glucose is called as hypoglycemia, more amount of glucose in blood is called as hyperglycemia. So a delicate balance between the hormones of the pancreas, intestines, brain and even adrenal. So you have hormones being produced by all these organs. So it is a coordinated effort of all these hormones which is helping us to retain and help the glucose level in our body. And this is what is called as homeostasis. Homeostasis is nothing but maintaining the actual blood glucose level. Now this diagram explains to you how the regulation of blood glucose is done in our body. Very important and very fantastic to understand how our body regulates the blood glucose. Now in this diagram, if you can see on the left hand side, there are two cylindrical things which is showing your blood artery in which there is a glucose level. The small molecules are what are the glucose. In the left side you can see when you have a low blood glucose level. For example, you had your food in the morning and then it's almost 12 o'clock, you haven't had anything, then your blood glucose will be like that. There is a low blood glucose level. But if you see immediately after I had a lunch, my blood glucose will be something like that on the right side diagram, where the high blood glucose level. So the body immediately senses it, okay. So if I have a low blood glucose, now we will discuss the first part where there is a purple arrow. When you have a low blood glucose level or when you have a high blood glucose level, pancreas is the one which comes into action. And you have in pancreas two types of cells, alpha cells as well as beta cells. It is the alpha cells which secretes a hormone which is called as glucagon, and it is the beta cells which secretes a hormone which is called as the insulin, which you all must be very, very familiar. Okay, so what happens when there is a low blood glucose level? What happens? The alpha cells secretes glucagon. Glucagon's job is completely opposite to that of insulin. Insulin's job is to reduce the amount of glucose in your blood. Glucagon's job is to increase the amount of glucose in your body as you require. For example, when you are starving or when you have had a very high exercise, okay, you are not having enough energy and you don't have enough glucose in your body, then which hormone comes into action? It is the glucagon. Immediately after having a lunch or having a heavy food, the hormone which comes into action is insulin. Okay, so they have both opposite in action. So now we were discussing about low blood glucose level. I have starved for a long time. Then it is the alpha cells which secretes the glucagon, and then it is the liver is the place where the next action takes place. So there is a communication between cells in our body, okay, without we realizing them. Okay, so the cells in the liver is that liver has got a fantastic role to play. Okay, most of the metabolism happens in the liver, and liver is a place where glycogen is stored for future use. Okay, so when you have had a lot of food earlier, so whatever you don't require, that glucose is converted to glycogen and it is stored in the liver. For what? For any emergency case like today, I have starved in the morning. I am feeling hungry because I don't have energy, I don't have glucose in my body. So what happened? My pancreas has secreted the glucagon, and then this hormone goes and gives a message to the liver. In the liver, what happens? The stored glycogen is broken down to glucose, and this glucose is coming to my blood. So you see from the left hand side there was low blood glucose. Now bottom you see that you have a normal blood glucose level. Okay. Now if I have a case where I just had my lunch, okay, now what happens? The pancreas, the beta cells comes into action. It releases the insulin. And then what does insulin do? It also helps in the fat cells to take in the glucose from the blood. So or the glycolysis is initiated and glucose is removed, and hence again there is a normal blood glucose level. Now, if you see the diagram at the right hand side, this explains to you in a better way. Okay. Now, here you should understand two things. Okay. Now, we know that when we need glucose, there are two things which can be done. Okay. One is gluconeogenesis, means inside your body itself, the body is helping you to produce glucose from other substances. That is what is called as genesis, means synthesis. Okay. So, gluconeogenesis. Second thing is what is done is glycogen is broken down to give you glucose. Okay. So, that is what is called as glycogenolysis. Okay. And there is something more which is called as synthesis of glycogen from glucose. So, whenever you have more glucose in your body, what happens? This glucose is converted to glycogen. This is what is called as glycogenesis. So, this is how usually it is done with the regulation of which are the two hormones, insulin and glucagon. So, here you can see that when there is a high blood sugar, there is an insulin is released from the pancreas, and then when the insulin is secreted, it stimulates glucose uptake from the blood and it goes into the liver where the glucose is converted to glycogen. While when you have higher blood sugar level, what happens? It stimulates, stimulates the synthesis of glucose. Whenever you have a high blood sugar, the glucose is converted to glycogen. Whenever you have low blood sugar, the glycogen is converted to glucose, by which hormone? The glucagon hormone. So, there is a very beautiful coordination between these two hormones, which are the insulin and the glucagon. Okay. So, this is what is happening. So, the regulation of blood glucose is largely done through the endocrine hormones of the pancreas, and there are other hormones, insulin, glucagon, somatostatin and amylin, which helps in the regulation of the blood glucose. So, we can see that here there is one more hormone which is called as a somatostatin. What is its role? So, this glucagon is having one role and insulin is having another role. There should be somebody at home to control them, like you have a traffic police. Okay. So, this hormone is called as a somatostatin. It is also called as the pancreatic policeman. Okay. So, somatostatin is found in the delta cells of the pancreas. This is the one which balances the insulin and the glucagon. And as a meal contains carbohydrates is eaten and digested, blood glucose level rises. Then what happens? Pancreas turns on insulin production and turns off glucagon production, while glucose from the bloodstream enters into the liver cell, stimulating the action of several enzymes and converts glucose to chains of glycogen, so long as both insulin and glucose remain plentiful. So, in this postprandial or fed state, okay, the liver takes in more glucose from the blood than it releases, and after a meal has been digested, the blood glucose level begins to fall. Okay. Now, in a healthy liver, up to 10% of the total volume is used for glycogen stores, and that is what was helping us whenever we have a depletion of glucose level. Now, we will just brush through just the how insulin works. So, when the cell needs glucose for energy, most of them are unable to use glucose. So, what happens? Insulin gives glucose access to the cells. Okay. So, cell has a small gate like thing. So, insulin has to come and bind to the receptor on that gate. Only then that gate opens and the glucose enters. So, insulin is the gatekeeper. Okay. So, it attaches to the insulin receptors on cells throughout the body, instructing the cells to open up and grant entry to glucose. So, you might have been wondering, what is this role of insulin? Okay. So, insulin has to come and bind to the receptor on the gate of the cell. The gate opens and then the glucose enters. So, low levels of insulin is constantly regulating throughout the body just to understand whether the glucose level is going up or not. A spike of insulin signals to the liver that blood glucose is too high. Okay. And the liver absorbs the glucose, then changes it into a storage molecule called the glycogen, and when blood sugar level drops, glucagon instructs the liver to convert the glycogen back to the glucose, causing blood sugar levels to return to normal. And insulin also supports, insulin also has another role. We only know about insulin as regulating glucose, okay, but it also delivers amino acids to muscles. Whenever you have a muscle tear, it is the insulin which helps to for this recovery process. And the liver stores glucose to power the cells during periods of low blood sugar. This is the advantage of glucagon. So skipping meals, poor nutrition, can all these lead to very low blood sugar level? By storing glucose, the liver makes sure that the blood glucose level remains steady between meals and during sleep. So when blood glucose falls, then the pancreas secretes the glucagon. Okay. So glucagon is one which instructs the liver to convert the glycogen to glucose, and insulin attaches to the receptors of the body cells and ensures that they can absorb glucose. So insulin and glucagon work in a cycle in order to maintain the homeostasis. Or glucagon interacts with the liver to increase blood sugar, while insulin reduces blood sugar by helping the cells use glucose. So to wind up, we were discussing about the regulation of blood glucose. We discussed about the normal blood sugar levels. We also discussed about the renal threshold of glucose, and we also discussed about the two important hormones, the insulin and the glucagon, which works in coordination to maintain the glucose homeostasis, thus regulating the blood glucose in our body. Thank you.